Thank you all. This is Jack Stein with the National Institute on Drug Abuse, NIDA. And my apologies for not being able to be there in person, but this is clearly the next best thing. I've had a chance to review the agenda for today that you all went through, and looks like you just really addressed so many of the critical issues. And it really is an honor to be sharing the platform with both Grant and Aaron, who we've worked with collaboratively at CDC and NIAAA for years together, and look forward to continued collaboration with them, particularly on this important issue. I know the time is tight, and you can't see me, though I am wearing a really nice suit specifically for today's presentation, so just keep that in mind. Okay, you should see the first slide, which is my title slide, and if you go to the next one, which is just a photograph of our director, Dr. Volkov, who I'm sure many of you have heard and perhaps have met, and she, of course, has been leading the effort here at NIDA for well over a decade now, and particularly extremely concerned around the opioid problem that we've been experiencing, both with respect to prescription drugs and heroin. If we can move to the next slide, which is entitled Addressing the Opioid Crisis, NIDA Research Priorities. This highlights actually what I'd really like to focus my brief 5-10 minutes talk with you all before we open it up for some discussion. I wanted to, since I know we've been talking about future opportunities, to give you a sense of the direction that NIDA has been going with our research over the last couple of years, and certainly needs to into the future. And I think it's an important heads up for certainly clinicians out in the audience, but anybody who is a researcher, it's a great opportunity to get a sense of how, in fact, we've been looking at our research portfolio for the immediate present and for the future. So I'd like to tackle a couple of these 5 major items very briefly with you. One is dealing with the treatment of pain, which is somewhat part of NIDA's portfolio as well as NIH at large. Secondly, prevention for drugs in general, and particularly opioid use disorders. Thirdly, preventing of overdose deaths. Fourthly, treating of opioid use disorders. And lastly, the implementation challenge. So if we can move to the fourth slide, which should be entitled Pain. Just want to give you folks a sense of some of the movement that's been going on in the research world, and actually some of the exciting things that's happening. I was delighted that Grant gave such a nice, thorough overview of the work that's happening that CDC has led with respect to guidelines around treating such issues as pain. It is a challenging one, and one of the things that we've been looking at is to get a better grasp of how, in fact, can you actually identify and determine the extent of pain. Right now, of course, it's primarily by someone's self-report, but looking at biomarkers to actually detect pain is one of the areas of research that's well underway at NIH at large. Certainly, are there new and improved ways to develop medications to treat pain that are either have no abuse, or at least we can actually reduce the abuse? So abuse-deterrent formulations is another major area of focus in the research that's underway here at NIH. And the third area I wanted to point out, which is that third bullet there, has to do with really alternatives to medications. And I think this really is what a couple of years ago might have been thought of as way in the future, but I think we're actually approaching this a lot quicker than we ever imagined, and that is the use of a transcranial magnetic stimulation and variations on that type of theme. There's some very fascinating research that's going on within our own intramural research program, looking at how, in fact, can the use of magnetic stimulation actually address both pain, and then I'll refer to it again in a moment when we talk about our better understanding of treating addiction. So it's kind of a new and exciting area. You just see a photograph there of one of the technologies that's actually underway and being studied. Next slide should focus on the second point that I wanted to make has to do with prevention. And obviously, I think we all would fully agree that if we could prevent drug use to start, that would prevent so many of the problems that we're currently facing in our local communities and in the country at large. What you're seeing in front of you is a very interesting study that was conducted by Dick Spoth from Iowa State University, and he has been one of the leaders in the prevention field for many, many years, and he and colleagues did a very interesting study where they looked at a couple of so-called brief universal interventions that are interventions delivered in school-based settings as well as in communities. These are prevention programs, one of them called the Life Skills Training Program. The goal being, if in fact these type of prevention interventions can be incorporated into schools and community, what kind of impact do they make on the ultimate use of drugs or the lack thereof several years in the future? This recent study that he reported on in the American Journal of Public Health not only verified the very good work that he and colleagues have been doing over the number of years, and you can see to the left, the blue and the red basically show what happens when you actually embed a family-based program in a community with a school component versus a control. We actually see some very significant delay in the use of drugs in general. But most recently, he did a data analysis to determine what kind of impact might it have on the use of specifically prescription opioids. And you can see on the graphs to the right also a very significant delay or reduction in the use of these type of substances. So we know that community-based prevention interventions such as these actually can make an impact. Moving on to the next slide, which should be slide number 6, with the title being Overdose. I'm sure, in fact I know it's been talked about today, so I will just briefly make reference to the very exciting news that's gone on around the ability to take advantage of an incredible medication called Naloxone that I know you've been focusing on a lot today, and re-emphasize, if it hasn't been said already today, that there's been 2 really significant advances in the research arena just this past year, one most recently. But last year in 2014, the FDA approved the auto-injector form of Naloxone, which you see pictured there, and perhaps have talked about already today. And then just last week, FDA approved the Naloxone, the nasal spray version of Naloxone, which is Narcan nasal spray. So we're very excited, and NIDA helped contribute in many ways to the ultimate development of some of these products, and we're looking forward to additional ones in the future to ensure that Naloxone is made easily available. Next slide highlights treatment, specifically some of the advances in anti-addiction medications. And I'm not going to go through this in much detail, but just reference a couple of the bullets that you see in front of you that highlight the fact that we're looking at various formulations of current medications that are currently out there. Can we use lower doses or develop slower release formulations to ensure the abuse liability is reduced? Mixture formulations such as combining naloxone and buprenorphine, of course, is currently used, but are there other formulations that can be used to, again, reduce the likelihood of abuse potential? Some of you may have, but perhaps most haven't, because it's a relatively new term for us here, which is called the prodrug formulation. And this is a very interesting one that's currently under study, which is the fact that it binds with the actual medication so that the medication only can become activated via a digestive enzyme. Again, reducing the likelihood of abuse because it needs to be taken in a certain type of manner. Long-acting is obviously of critical importance. We currently, of course, have Vivitrol, which can last for several months per administration. But currently, we're looking at a medication which is basically a subdermal implant of buprenorphine, which actually could last for upwards of many, many months. And that's currently actually right now pending FDA approval. Vaccine development is another really interesting area that's been a challenge, but we're making some significant progress. And the idea here with the vaccine is to stimulate the immune response to actually create antibodies that bind to a drug, making them too large to cross the blood-brain barrier. And lastly, as I mentioned a little earlier, we're also looking at alternatives to medication in general by the use of some transmagnetic stimulation. And it's right now being looked at, right now primarily with cocaine addiction, but we're optimistic in the direction that's going. And moving into the last piece I wanted to highlight, which has to do with implementation, which I think actually reflects some of the issues that Grant was mentioning earlier. What you see before you is an interesting study that Hannah Knutson conducted a number of years ago. And just in a nutshell, what it's showing is that in substance abuse specialty treatment program, even though many of them may actually provide technically the access to medications such as buprenorphine or naltrexone, still not many of them are actually using it. And we know that's for a variety of reasons. So we do have a huge challenge to ensure that MAT is utilized. And let me just wrap up with a couple of more slides. The next one actually demonstrates why this, I think, is so valuable to actually focus in on. What you're looking at here is an interesting study conducted by Robert Schwartz up in Baltimore, recently published, which basically shows that this was actually looking at data in Baltimore, and the red line reflects the heroin overdoses in that city over the last decade or so. And what is really fascinating is the green dotted line reflects when buprenorphine was introduced into the community. So he's building a very strong argument to show as we allow MAT to be utilized, we can have a significant preventive effect with respect to opioid overdose. The next slide, which is approaching one of my last slides, focuses also on a really terrific study that Gail D'Onofrio from Yale University published in JAMA recently, which basically shows, and you can see it reflected in the purple bar all the way to the left, that when buprenorphine is actually introduced in an emergency department setting versus simply referring or doing a brief intervention with respect to a substance use disorder detected in the emergency department, we can make significant impact in retaining people in treatment. And so I think it's taking the SBIRT concept to a new level and introducing MAT. With that, my last two slides are just some resource slides. The next one should be titled Federal Resources, which basically pulls together everything from all of our respective agencies and many others in the U.S. government with respect to dealing with the opioid issue. So it's a terrific one-stop shop repository. And my last slide is basically or next to last slide is just a commercial for NIDA at large. Drugabuse.gov is our website. We have what's called NIDA Med, which you can find right on our first page of the website, which is really designed for clinicians to address all things related to embedding addiction-related issues into the medical setting. And my last slide is actually a commercial for my email, which, again, I direct the Communications and Policy Office, and our job is really all about helping translate the research into practice. So please do never hesitate to contact me at NIDA or any of us here to help. So with that, I'll stop and turn it back to our coordinator.